Namaskar. A very good evening to everybody who are participating in our 2 days international webinar on COVID-19 and lockdown, a challenge to corona fighters and corona survivors from social standpoint, organized by Department of Philosophy, Psychology, Women's Studies, Psychological Counseling Cell in collaboration with Internal Quality Assurance Cell, Basanti Devi College. So before we begin our 2 days journey of this international webinar, on a digital platform, let us all chant the Shanti mantra in the memory of all the corona fighters, the doctors, the nurses, the healthcare providers, the frontline workers, especially the domestic caregivers, women, migrant workers, and other marginalized people. Asato ma sadgamaya, tamaso ma jyotirgamaya, Mrityorma Amratam Gamaya. Om Shanti Shanti Shanti. Which means, lead me from the Asat to the Sat, lead me from the darkness to the light, lead me from death to the immortality. Om Peace, Peace, Peace. I took it from Brhadaranyaka Upanishad. Today it's 20th July of 2020. So it has been a long time we are fighting the century's first pandemic in the January 2020 who declared this coronavirus a pandemic, keeping in mind the worldwide spread. During this course of time, millions of lives have lost fighting this pandemic, while several unnamed heroes have risen to the occasion, making our lives more safer and meaningful. Under this scenario, the current webinar is an effort of us to extend our gratitude and to show our tribute to all these people who are risking their lives every day, every moment, just to ensure our life intact, continue and safe. To understand, recognize and acknowledge the struggle of all these frontline people, our eminent speakers who are different stalwarts of different fields will speak on the following sub-themes. Number one, the vulnerabilities of women in the lockdown and the role of social support. Number two, managing the psychological impact of a pandemic and lockdown. Number three, corona warriors, experiences to be shared by corona survivors. And number four, no lockdown in lockdowns, especially focusing on people who are frontliners, the healthcare providers, bankers, media persons, domestic caregivers, entertainers, etc. Number 5, living by the age, identifying sufferers and suggesting some relief strategies for them. So to begin with, I would like to welcome our principal, Honorable Principal Madam, Dr. Indrila Guho, to kindly inaugurate the session. Ma'am, it's over to you.
Thank you, Momita. Great honor for me. It's a pleasure for me also to inaugurate the webinar today. It is an international webinar, COVID-19 and lockdown, a challenge to corona fighters and corona survivors from social standpoint. This is a very pertinent, extremely pertinent topic. And I'm happy that the Department of Philosophy, Women's Studies, Psychology, and Psychological Counseling Cell could actually come together, join hands to choose a topic which is extremely pertinent and extremely important for not only our physical health, but also our mental health. Um, I was talking to my psychological counselor the other day, Srimati Shagota Dotto, that how students are coping up with this situation. We have to be the counseling. So, particularly today's webinar and tomorrow's webinar will be an international webinar because we have speakers from all over. And I'm very happy that there are 5 speakers. I will take the name of Dr. Shonchita Ghosh, Dr. Ranjan Ghosh, Srimati Shati Bhattacharya, Dr. Rishabh Mukherjee, and Professor Mohammad Mazharul Hannan. We call him Hannan sir. He's a very senior person who visits our college quite often whenever he is around. I actually welcome all of you who are participating in the webinars as resource persons, who are connecting with our students, not only the students of Basanti Devi College, but also there are many other students who have joined us from different colleges through the psychological counseling cell. Um, these webinars, we are continuously having different webinars organized by different departments in collaboration with internal quality assurance cell, and the IQSC coordinator, Dr. Aditi Sharkar, is always with us. We work together very hard to make it a success. I know that so much hard work have been put in by all these departments to make this happen today. And I welcome all the listeners also who have joined us. I'm quite sure that these 2 days will be extremely beneficial for all of us, not only to have knowledge about our physical health due to the pandemic situation and how to overcome the mental stress associated with this pandemic. This is extremely important because in every newspaper, media, electronic media, we have come to know that keeping mental health intact is a challenge of today. So there will be focus on women empowerment, mental health, corona fighters, corona survivors, and many other topics which the resource persons will take over one after the other. And I'm quite sure that who have joined us today in the webinar, I can see the number is quite large. It is already 114 have joined us, 115. So I'm quite sure that we all will be benefited from today's international seminar. And I thank all the organizers on behalf of Basanti Devi College. As a principal of the Basanti Devi College, I'm very happy that this could happen in a very short notice. We arranged this webinar, I think, within 10 days of time, arranging all the speakers, their topics, then actually intimating all the listeners, preparing posters, brochures, and other things. Before I end, I would like to mention one other thing, that there will be one poster presentation by the students of Psychological Counseling Cell, which I have already gone through. They have put in a great effort in order to actually make this poster presentation. I would request all of you to stay tuned At the end, after the speaker's speech is over, we will hand over the poster presentation to happen, and then maybe again I would like to mention that again tomorrow, if we can start the poster presentation once again, because it is, I think, not more than 8 minutes. So if you can listen to that, our students will be encouraged. Not wasting much time, I would request you to be with us throughout the seminar today and tomorrow. And I wish this international seminar a great success. Thank you very much.
Thank you, ma'am, for your inspiring words, which will guide us to continue and to go towards the success of today's journey. Now, I would like to invite our webinar convener, Dr. Aparna Sadhu, for her deliberation.
Thank you, Momita. Good afternoon to all. I, Dr. Aparna Sadhu, on behalf of Basanti Devi College, welcome all to our international webinar. We are very privileged to have you all in our webinar. Our webinar deals with the pandemic, which is bringing tremendous obstacle in the current situation all over the world. COVID-19 has already fundamentally changed the fabric of our society and impacted the global geopolitical landscape. The novel coronavirus was detected in December 19, is now affecting many countries, rising concern and anxiety in individuals subjected to the threat of highlighted COVID-19 as a unique threat which had added to panic, stress, and the potential of hysteria. During this period, some changes have occurred in our lives. For example, it has created huge impact on human relationships. A new kind of patriotism is seen from the frontline people of the society, such as our doctors, nurses, teachers, workers, police, etc. There is a tremendous rise of technomedia as most of the educational institutions are conducting their teaching learning process through online classes. This is an all-over change which had come specially in our understanding and thought process. It is definitely a painful situation in our life, but we must fight and survive from this pandemic situation. Everybody is suffering in his own way. This webinar aims at looking at the pandemic from a special social standpoint, from the point of the fighters and also from the point of the survivors of coronavirus. The fighters are trying to cope up with the virus, and as a consequence, many people have survived. Sometimes society admires the fighters and prays for the victims. But sometimes the society becomes hostile to the fighters and unkind to the survivors or to their family members, being afraid of the spread of coronavirus. What is the outlook of society towards these persons? And how do these persons evaluate the role of society? This should be the topic of our discussion in this webinar, where eminent persons will share their views with us. We are waiting to hear them, and I am sure you will enjoy the session. The objective of the webinar is to help people deal with the problems they are facing in emotional and social field by throwing light on how they can manage them. We have a doctor and a media personally who will say something from their own experiences. We should be aware, not afraid. We should be distanced physically, but connected mentally. We should try to help others instead of criticizing. It is a time when we are to extend helping hands because men are in distress. It is easy to be rude and unkind, but difficult to be humble and polite. Let our soul awake over the minor things we boast of to achieve the higher goal of humanity. So, I will not extend my words because I know you are all waiting to hear the speakers. For your kind information, I would like to say that the recording of the webinar will be available on the official website of Basanti Devi College. Thank you. Thank you to all. Over, Momita.
Thank you, Dr. Shadhu, for your wonderful words. Now, let me invite our webinar coordinator, Dr. Anindita Banerjee, to kindly give her keynote speech.
Unmute করো অনিন্দিদি প্লিজ আনমিউট প্লিজ আনমিউট
Okay. Good afternoon, everybody. Heartiest thanks to Principal Madam, my colleagues, and all the members who belong to the family called Basanti Devi College for providing me this opportunity to deliver the keynote address of today's webinar. At the very outset, let me convey my good wishes and warm welcome to the honorable speakers and all present here to attend. Let us imagine that this year is not 2020. It may be 2019 or 18 or any other year whatsoever. And someone says that everything is paused for almost 4 months all over the world and nobody knows when will everything become normal. We would say to the person, have you gone mad? This is just impossible. But unfortunately, the fact is that this is really 2020 and we have no way to say the quote unquote impossible. The outbreak of novel coronavirus has stopped the normal go of life, not only locally, but globally too. It has caused severe problems in the functioning of all countries in the world. Health, medicine, education, business, economy, and all the aspects of human life are badly affected. A situation the world has rarely witnessed is the crisis of human to human transmission of the virus, which has affected 213 countries throughout the world. On January 30, 2020, the World Health Organization declared the coronavirus outbreak a global public health emergency. More than 10 crore people have been affected globally, and men, the most civilized creature in the world, are just helplessly watching the death toll every day. India's overall caseload rose to 10 lakh according to the latest statistics. The number of people who have recovered is increasing, but the number of active cases too has risen. Scientists are trying their best to find out vaccine. People are advised to wear masks, stay at home, and to maintain social distance so that the transmission chain can be broken. Just like other countries, India went through a period of complete lockdown all over the country. Till now, we all are fighting and we don't know how long this struggle will continue. We are fighting against this virus for our survival. But there are some frontline fighters who fight for others. They do not stay at home so that others can stay at home safely. They also have families with elderly persons or babies, but their priority is their social and professional responsibility. We offer our heartful thanks and tribute to these frontline COVID warriors through this webinar. Among the frontline fighters, first come the doctors, nurses, ward boys, pathologists, pharmacists, and their ilk. As stricter norms came to be implemented with lockdown, the policemen came to the fore, and also the persons who are associated with administrative services. During the period of lockdown, the providers of essential service made their presence felt. Milk, vegetables, grocery, newspaper, water, electricity, telecommunication, and banking, among others. Gradually, the list of corona fighters also expanded. There was a fair bit of mixing and cross fertilization. Thus, the policemen started supplying rations and medicines. The postman started delivering cash and essential commodities. Sorry. Railway coaches turned into isolation wards, and the media started awareness campaign. Even ordinary people, the local club, puja committee members, volunteered to distribute essential food and commodities to needy people who are suffering economically due to lockdown and no work. Sorry. Actually, this is the picture throughout the world. Our fear for the virus has taught us to work in a collaborative manner, freeing ourselves from the boundaries of caste, creed, and religion. We are fighting against coronavirus with the hope that we shall overcome someday. But we have also to fight against ignorance, inhumanity, cruelty, selfishness, and ego, which is really unfortunate. These corona warriors are sometimes treated very badly and they receive inhuman behavior from persons for whom they risk their lives. For example, doctors, policemen, or social workers have been assaulted or attacked while trying to enforce lockdown or going into close contact with COVID patients. When the whole world is lauding the efforts of doctors, some paranoid residents are refusing to give houses on rent to people in medical profession, fearing the spread of coronavirus. The corona warriors have also to face a big challenge from the social standpoint. Among the speakers, we have a doctor, Mr. Rishav Mukherjee, and a media personnel, Srimati Swati Bhattacharya, who will deliver their speeches on the second day of our program and will share their experiences and also the role of society in this pandemic situation. Basanti Devi College is a girls' college, and so we feel that something should be discussed about the problems which girls and women are undergoing throughout this period. Domestic violence against women is already widespread in India. Now, at the time of the COVID-19 pandemic, the United Nations recognizes domestic violence against women as a shadow pandemic. The COVID-19 pandemic has triggered a huge spike in domestic violence against women in China, Australia, France, the UK, Spain, and Bangladesh. Our speakers, Dr. Shonchita Ghosh and Srimati Swati Bhattacharya, will say that the women who are playing an indispensable role on the front line in the war against COVID-19 as health workers, sanitation staff, caregivers, scientists, and as long-suffering housewives in our country or outside the country, this pandemic situation is indeed stressful for people. Fear and worry about our own health and the health of our loved ones, our financial situation or job, feeling of isolation and loneliness due to social distancing, and a feeling of insecurity have deep impact upon us. Today, we have Dr. Ranjan Ghosh with us, who will speak on the topic how to manage the psychological impact of COVID 19 and lockdown. And the last but not the least, the challenges that the corona survivors are facing from a social standpoint are worthy to be discussed. The patient and his or her family members have to face a tremendous challenge because the patients are to be hospitalized without visits from family and friends whose emotional support they miss. His family members, being quarantined and stressed, go through a horrible experience of anxiety and insecurity. Nowadays, many patients are asymptomatic and recovery rate is also high. Still, the social standpoint of a corona patient is something unique. If a corona patient dies, the virus may still be in the dead body, and so people become afraid to handle or touch a dead body. There have been several cases where the family members had great trouble in the cremation of the dead body of a COVID patient. Society is afraid of COVID patients, and so they receive sometimes unpleasant experiences from the social standpoint. We have with us Dr. Rishabh Mukherjee, who is a corona fighter as well as a corona survivor. We are grateful to Dr. Mukherjee because within his busy schedule, he has agreed to spend his time to share his experience in our webinar. When he became a victim and suffered a lot, he will share his experiences, and after coming back, now he is successfully taking charge as a doctor in a COVID hospital and is fighting against the virus. Professor Mazharul Hannan will be our last speaker to deliver his valuable speech regarding our thoughts to meet the post-COVID. We believe that one day the world will be free from this curse and we shall overcome this crisis. In this pandemic situation, we cannot come together, but our ideas can. So, we are going to have a wonderful session where the speakers will share their views with us. Bad time comes, but nothing is permanent. Even in the darkness of the night sky, there are bright stars. We know every cloud has a silver lining. So, though we know that we have to fight together now, but one day, surely, we shall win. We shall overcome someday. Thank you.
Thank you, Dr. Banerjee, for wonderfully drawing a picture of our activities we are going to undertake in our 2 days webinar. As you have rightly said that we cannot come together physically, but mentally we can, sharing our thoughts. So I hope this platform will be a great success for all of us in terms of sharing our thoughts, sharing our views, and sharing our understanding about the topic, which will help us to deal this crisis more confidently and with more stability. Now, without much delay, I would like to start our session with our first speaker, Dr. Sanchita Ghosh. So before we start, a general instruction to all the participants who have joined to kindly please keep your audio and video in inactive mode. And secondly, you can put your queries, your questions to our speakers in the chat box. It will be selected by our committee and will be given to our speakers, and our speakers will accordingly answer to them after they are over with their speech. So now I'm going to welcome our first speakers for today, Dr. Sanchita Ghosh, Monitoring and Evaluation Officer from APWLD, Chiang Mai, Thailand. So before I ask her to begin, Just a few words about her to introduce her to all of you. Dr. Shonchita Ghosh is a social scientist, a gender activist, a women rights activist in the areas of social science. She is currently attached with the APWLD, stands for Asia Pacific Forum for Women Power and Law, Chiang Mai, Thailand. She is a professional with more than 17 years of experience in research and programmatic aspects of violence against women and girls. She is a doctorate in development studies. She has worked with various international and national NGOs in the areas of program planning, training, evaluation, women and children health. She has developed several digital monitoring systems for women right based organizations, published papers on gender, violence, mental health, and body rights, reproductive rights in international and national journals like Economic and Political Weekly, Sage journals, etc. So let us all welcome her in today's session. She will be discussing on capitalism and corona, the disproportionate impact on women and girls in South Asian context. Ma'am, it's over to you.
Um, Thank you, Momita, and a very good afternoon to all. At the outset, let me express my deep gratitude to Principal Ma'am and organizer from Basanti Devi College, Kolkata, for giving me the opportunity to speak on such important context. Also, heartfelt thanks to eminent speakers, students, and friends for your patience and support. As Anindita was saying, and Principal Ma'am was saying that uh, it's a tough time, and we are really fighting with the current situation. But there's something different for women and girls in all over the world, not only in India. And these inequalities actually in every sphere of life already entered in our DNA. The current pandemic is actually exploiting and exposing inequalities of all kinds, including gender equality, inequality. In the long run, its impact on women's health and rights, psychological well-being, and freedom could actually harm everyone. Um, Now, if we say why I was focusing on capitalism and the context of Corona, if you look into can we request other people to please mute their microphone? If speaking at my place, uh, can someone please? Somali Banerjee, can you mute your microphone? Miss Somali Banerjee, can you please mute? Anyway, let me continue. So, after it's very disturbing. Somali Banerjee,
Just a second, ma'am. Give us a moment. We are trying to
sure.
put her on mute.
Okay, please. Perfect. Thank you. Okay, so as I was discussing about why we say that there is a problem in capitalist societies and there is a problem with the current pandemic. After the influenza pandemic in 1918, the worst hit might be COVID-19 that engulfed a large section of population across the world, especially Asian countries, and largely in crafting up pandemic and epidemic management. plans that go beyond a generic medicine and include a community support to deal with such situation, according to WHO. Now, China, India, Indonesia, these were the countries which actually have lacked in country-specific operation plans to respond to different phases of the pandemic. However, in current situation, not only these countries, but also, other South Asian countries like Pakistan, India, Bangladesh, Nepal, are actually struggling with a huge crisis here, human life lost, economical debt, as well as challenging a social system that creates a concern for women and girls. Now, as I already said earlier, that capitalism is facing at least three major crises. How one is that pandemic-induced health crisis has rapidly ignited an economic crisis, with yet unknown consequences for financial stability. And all of this is playing out against the backdrop of climate crisis. We all know that, and that cannot be addressed by only a business as usual, quote unquote. Until just 2 months ago, the news media were full of frightening images of overwhelmed firefighters, but not overwhelmed healthcare providers. Why I say so? In past few decades, almost all big farmers were mostly engaged in medicalizing the different diseases, giving less focus on public health infrastructure, which is on stake now. Did we think ever? No. Okay. And on the other hand, the COVID-19 crisis is exposing still more flaws in our economic structure. For example, in the US, if you say, and not only focusing on decade-long deterioration of workers' bargaining power, but also market-driven economy powered by mere globalization. Telecommuting simply is not an option for most workers, And although governments are extending some assistance to workers with regular contacts, the self-employed may actually find themselves left high and dry, especially the migrant laborers, daily wage earners, and domestic workers. And of course, the frontline health workers from mostly the unorganized sector also will bear the burden in almost all countries of South Asia. So now let's see what is happening in South Asian context in terms of, the death toll and the effect of the pandemic. Let me just focus a few data, not making you all heavy, because every day we are watching news and every day we are seeing videos in WhatsApp and Facebook that these many people are dying, these many people are survivors, they are fighting with the virus. And of course, the economic impact is that is on us due to job. The first country in Saudi Asian context to report a confirmed case was Nepal, which documented its first case on January 24. As of July, after that, there was no lockdown in these areas. And the first lockdown, I think it was in the month of March. We all delayed in locking down, which actually increased the cases. Now, if you see Afghanistan, if you say in current date, as of July, Afghanistan has reported more than 22 cases with more than 1,000 deaths. Bangladesh has confirmed more than lakhs of cases and more than 2,000 of deaths. And concern for us, India, as ma'am said, more than 10 lakh cases now. Of course, more than 25,000 deaths. We are really in problem. We are really in problem. Because I was going through some data. Is there any data on gender specific death data? But I was not able to find. Maybe WHO will come up with some data. But death is not the ultimate concern. The ultimate concern is living in such society of stigma, full of stigma and discrimination. So, as I said earlier, that India, Pakistan, and Bangladesh were three South Asian countries that overtook China in terms of the number of coronavirus cases, especially India. And almost all these countries imposed a nationwide lockdown to combat with such situation and to flatten the curve. Um, India's upper middle class, what was the effect of this lockdown? India's upper middle class may be comfortably barricaded inside their capacious homes, but the poorest, marginalized, and most vulnerable slum dwellers live in chicken by bowl and are extremely vulnerable to contracting the infection. Not just the slum dwellers, but also the ordinary working people in Indian cities who have to live and work in small spaces are also at severe risk, catching the virus or losing their jobs. We have seen many photos in social media. People are walking miles and miles only to reach their home because they don't have any livelihood option in the cities they were working. Most of the migrant population whose families are in villages and are experiencing a double burden of loss of livelihoods. Now, in the small span of time, I can speak on this for hours and hours, but still we only have 30 minutes. Let me first focus now why I was making the point that there is an impact, a disproportionate impact in the lives of women and girls. How? Let us throw some light here. So what are the three impacts majorly? Economic, health, and psychological impact. Now, what are those? I call it living in continuous fear. Let me focus one by one. How and why we think capitalism and other modernized aspect of job and everything in a society are actual culprit even during the pandemic. It is because in the era of IT boom and high migration towards the more developed countries and places, men take the center stage while women are at backstage, taking care of household, children, blah, blah, and blah. While on the other hand, as women also go for work and employed, we are the double burden of the family, in time of work from home culture and maintaining a social distancing, workload from office and catering to the need of so-called family takes a huge toll mentally and physically, in to be a perfect. I forgot to mention about that we have supportive husbands, quote unquote, as if they are supporting and helping a lot, but actually portraying a phenomena of chauvinistic colonialism. I am not generalizing here all men, but I am just speaking about a socialization process where men need to think in that way and women need to think in that way. That I was focusing more. Actually, if we call about a situation where women have to give caring services to their family, which in turn creates more concern for women as they also are socialized to accept themselves as Doshabhuja, playing a multiple role of mom, wife, employee of the year, feeling more pressure to be perfect. So in that case, if we analyze what kind of stress of the lockdown, doubled with the fear of job loss, is a mental burden hovering over many families, especially women. Financial independence in case of working couple is at stake, and women who are already vulnerable to COVID job losses have many more to fear because due to the discrimination persist in the society, any pandemic will affect disproportionately between men and women. As more countries report infection and lockdown, more now coming to the evidence where actually we are, seeing this kind of impact. There are many studies by UN Women and WHO where UN Women call it a shadow pandemic, more domestic violence is happening due to the lockdown, because the domestic violence helplines, shelters across the world are actually reporting rising calls for help. According to the UN Women, published in April 2020, in India between March 25 and 31st, more than 2,000 complaints of domestic violence were made by women. This 68-day period recorded more complaints, and than those received between March and May in previous 10 years. In this case, UP and Uttarakhand, if we say a state-specific data, UP and Uttarakhand actually reported more cases, followed by Haryana and NCT, National Capital of Delhi. One recent data released by NALSA, National Legal Service Authority, suggests that the nationwide lockdown has led to a rapid increase in cases of domestic violence. The data, which is categorized according to different states, as I said earlier, that stated that each and every state are actually reporting horrible stories of domestic violence. And this isn't unique to India. Early in April, UN Secretary General Antonio Guterres said that there was a horrifying global surge of domestic violence all over the world during the lockdown. And also, like the calls to helplines doubled in Lebanon, Malaysia, and tripled in China, and compared with the same time last year, according to the UN. Only domestic violence? No. We say fear is where the home is. While the lockdown is helping to control the spread of the COVID-19 virus, one aspect of people being at home for extended period of time has left all shocked: the rise in number of child abuse incidences and child trafficking. A PTI report stated that during March 20 to 31, the first week of the lockdown, the Childline helpline, that we know, the Childline 1098, received over 92,000 calls. 92,000 calls from across the country, and these are only calls. There are many calls which are not being reported. Remember, asking for protection for abuse and violence for children. According to PTI report, the National Commission of Women also received 315 complaints of domestic violence and child abuse against children in the family. Not only this, a greater risk of child marriage. India's COVID lockdown is making it easier for girls to be forced into child marriage and teenage pregnancy. Not only in India, it's also in Nepal and other South Asian countries as well. Child trafficking, child marriage, forced pregnancy, that is teenage pregnancy. Despite its prominence in the India, authorities cite reasons unique to COVID and subsequent lockdowns for the spike. Most importantly, poverty, less job option for families, less option for migrant people are making concern for future of the girls in many parts of Southeast and South Asian countries. UNESCO estimates that nearly 90% of the students, girl students enrolled in education globally, children and youth, and including nearly 743 million girls, will be affected by this pandemic. And COVID-19 situation will also affect the school closure, especially in Nepal, Bangladesh, Pakistan, and India. Now coming to the third point, connecting with this, as I was saying, that forced teenage pregnancies and forced pregnancies, as the lockdown became new normal in the life of women and girls, risk of unintended pregnancy, is spiked up all over the world. India says it has protected abortion as medical essential service in the coronavirus lockdown, but experts says women and girls are struggling with their getting medical help, and may resort to risky alternatives because they are not getting that access to hospitals, because hospitals now have no beds, and there is still a stigma for going to hospital for abortion services, which were already in problem earlier. Now it has increased. With no transport services, yes, due to the lockdown, limited healthcare and movement restricted, campaigners predict that COVID virus crisis could push women to take abortion drugs without supervision or seek help from people who lack training. Now, these are social physiological effect. What are the psychological impact? I mean, which we call a long-term disquiet. I'm sure there will be more discussion on this after my speech, and a lot of people actually in this area of psychology and how psychological impact creates a concern for women and girls. I will also learn a lot from the discussions, but just giving some context in this, due to various social, cultural, and economic factors, women are facing a sharp increase in caregiving responsibilities with even less freedom, space, or economic security, acute stress, overburdened responsibilities, and meeting expectations to maintaining stereotyped social roles. Women are actually at risk now, especially caregivers, frontline health workers, domestic helps, and also housewives. Single women are facing concern in the pandemic. How can we deal with such situation in the long run? Do you have answers? I guess no. According to the WHO, guideline, there are some, very superficial ideas to deal with certain situation. Those, let me just concluding my discussion, because I think we already have more than half an hour now. Most importantly, we actually need to focus on prioritizing women and girls' health from all perspectives, essential healthcare and access, flatten the inequality curve first, and proper legal and counseling support to survivors, appropriate measures to tackle the situation of child marriage and trafficking. But we have to go along. We have to find some ways to deal with some situation. And last but not the least, let me conclude my discussion with this idea of the pandemic provides an opportunity to build a resilient, healthy, fair, and zero carbon economy against capitalism with more social support and negotiation power for women in a stigma-free, equal society. Thank you very much. Is there any question listed in that so that?
Thank you, ma'am, for your wonderful deliberation, for your engaging, interesting, and very, very informative speech, rather interaction on the very important issue nowadays we are facing in this lockdown period, that is violence against women and girls in South Asian context. I would like to invite our webinar coordinator, Dr. Anindita Banerjee, to kindly conduct the question answer session.
Okay. Thank you, Momita. Thanks to our honorable speaker, Dr. Shwantita Ghosh, for her wonderful presentation. Here, some questions have come to Madam. A question from a student, Rita Dash. She has asked, how to manage this crime of domestic violence? Actually, we have heard about the problem, but where should we get the remedy?
Can you be a little bit louder? I don't know if something is happening with my speaker, or I think the sound is very less. Is that happening with my speaker?
Shall I repeat? Shall I repeat? I am audible?
Yes, please.
Shall I repeat?
Sorry. Yeah, please repeat.
Okay, one of our students has asked, Srimati Rita Dash, she has asked how to manage this crime of domestic violence. Yes. How to manage this crime of domestic violence?
It's a very big discussion. To fight with such situation, the concern was already there. we have a large percentage of women actually facing this kind of problem in their home, intimate partner violence from their in-laws, from family members, for husbands. The first thing I think it is important to, to take a helpline things, to take the support from helpline. We have 138 and we have other helpline numbers. We have the NGOs that are working as support, like survivor support services. And it is really important because nowadays women, if they face domestic violence, they can't go outside, they can't go to the police station to lodge or to complain the situation, because of course everything is locked down. So the situation is really problematic. So I think it is really important even for the state also to strengthen their the helpline services, and women need to call to the helpline services, and not only them. Why to put pressure on women? I think we as a member of the society have to help them. If we come across any cases of domestic violence, I think it is really important to report to the helpline number, and what kind of support that woman can get, counseling to her. And of course we need to discuss with the family members also. Like, it is already being a challenging situation for women to be in home for 24 hours, catering to the need of each and every member of the family. Please be sensitive, please be understand that we are women too. Yeah, I think important is to take help from the healthcare frontline workers, as well as the helpline numbers are more important nowadays. Yeah.
Okay. Ma'am, we have another question.
Yes.
Women who do not suffer from domestic violence are lucky, but what role do they have in such situation to help women who suffer?
Can you wait 1 second? I should take the thing, because I don't know why this sound is very late. Sorry. Okay. Can you please repeat? I'm so sorry. Can you please repeat the question?
Okay. The
Yeah.
question is, some women suffer, but
Yes.
the women who are privileged, who do not suffer from domestic violence, what role do these women should play towards
Okay.
the women who suffer?
I have a problem with this statement. Women are not privileged who don't suffer domestic violence. Yeah. I think they are lucky, because we are not privileged not to suffer this. This is not a normal thing that women should face, and then where we are not facing, we are privileged. Of course not. Each and every woman suffers some kind of violence in their lifetime, either domestic violence or sexual violence or so and so. So who are not domestic violence survivor, or who are not facing the violence, may be a good bystander. Now, what is bystander? Bystander is a person who is standing or who is experiencing or witnessing the violence that their friends or colleagues or sisters or mothers are facing. Stop the act then and there. Stop it. Tell the perpetrator, you are not right. This is not okay to perpetrate the violence against your wife, against your mother, against your daughter, or against any female colleagues. Yeah, I think that is very important. It is not only onus of a woman only. It is not a responsibility of a woman to stop the domestic violence. It is also a responsibility of men in our society to stop such crime. And there was a campaign by Breakthrough India, like Bill Bajao. I think some of us have seen that campaign. It was about, if you see some problem, just stop that then and there. Tell them, hey, this is not right what you are doing. If we can't raise our voice, this is not going to end. We have to raise our voice. Okay? Yes, sometimes as a survivor, some women are not able to raise their voice, and it is absolutely okay. We have to support them. We have to
provide our support to those women who are really in need of that. Yeah. So bring a society of resilience. Why not create a society of resilience and a society of, good social support against such crime, and, provide a support to women and girls who can live happily in their life. Yeah.
Okay.
Huh.
Thanks, ma'am. Another
Yes.
question has come.
Okay.
Another question has come. Do
Yes.
you find difference in the experiences of women in
Hmm.
terms of the class or religion in India and elsewhere?
Oh my God, it's again another session, I think. If you ask me, I can speak hours and hours on that. Okay. There are some variations of in the cases of violence according to class and caste, but women are vulnerable everywhere. Okay, in every classes, in every caste, they are vulnerable. Of course, more marginalized women faces more problem, more challenges, because they are marginalized, because they are from lower caste, or they are from, lower middle class of the society, have no economic bargaining power. They may face a problem, but actually it cut it across the class, caste, and everything. So I think all women are vulnerable in this, but we need to focus and we need to provide more support to the woman who comes from a marginalized population, sometimes indigenous population, also sometimes for a poor background, because they don't have their bargaining power, or they don't have the negotiation power to, fight with such problem. Yeah, maybe we need to focus more on that. Capacity building, more economic prospect, or more economic options for them. Important is to have a job, or important is to have a good family, good education. A lot of we can help in many different ways. It's a big discussion, but we can have a next webinar on that. But I think now the time is short. But I think we have to help a woman from every classes, every castes, every places of our world. Yeah.
Ma'am, we have one more question,
Okay.
and
Okay.
last one. It is
Yes.
from Piali Haldar,
Yes.
teacher of Basanti Devi, Department of Women's Studies. She has
Okay.
asked, disabled and LGBT community people are facing more violence too. Will you throw some light on that?
Oh my God. It's, and again, I think another session. Can you please make another webinar of listing all this context? Yes. I was discussing about women, that also includes trans and cis women, and also women from LGBTQI communities. Yes, they face a lot of problem, a lot of discrimination due to, a stereotype thinking of non-binary, being non-binary. So the term non-binary is, I do not believe in either male or female, but I believe in an inclusive gender, where we actually welcome the LGBTQI people. So what happened? The homophobic society and the society of binary people, who doesn't accept any other gender apart from men and women, they pose more challenges to LGBTQI community. They don't understand that this community need support, need capacity building, or need at least a equal space in the society. Yes, just because of I believe in my different identity doesn't mean that I am not acceptable in the society. I may not confined to one gender, but as a LGBTQI, like lesbian or transsexual, or bisexual people, I also have the right to live. But in our stereotype society, not only in India, it's I think across the world. We were conducting a pride parade in Thailand some months earlier. So there people were sharing their stories of how discrimination happens in the society against the LGBTQI people, you know. And of course, the number is more in India. Nepal, Pakistan, Bangladesh, because of our already, social stigma in the society for these people. I think we really need to focus on, categorically focus on LGBTQI people, owing to, giving them more power to raise their voices. It is really important to listen to them, or it is not them, they are also part of society, and we are also part of society. We all are, like, I confine myself as non-binary. I don't believe in either male or female. I also can call myself a queer feminist activist. So it is really important to not believe a binary section of a population. It is important to raise voice for LGBTQI people, for their concern, for their discrimination. A lot more discussion can happen next time. Yeah, it's another big area. Yes, yeah.
Okay, ma'am. Thank you for your wonderful presentation. And
You're most
we shall
welcome.
stop here because we have very short time.
Absolutely. Yes, yes.
Over to Momita.
Thank you very
Uh,
much. Thank you.
Thank you, ma'am, Dr. Shonchita Ghosh, for your enthralling and engaging and also brainstorming interaction with us. We are really, really hopeful to have you in future on the upcoming topics we are discussing right now. And thank you, our audience, for asking questions, for pointing towards such important issues. Thank you, Dr. Banerjee, for wonderfully conducting the session. And thank you, ma'am, Dr. Ghosh. We are hopeful to have you in future with
Yes.
us.
Thank you
Thank
very
you.
much, Bhumita. Thank you.
So, after the session by Dr. Shonchita Ghosh, we can see that there is a huge toll on our mental, physical, and social health, especially in this context where we are forced to live in social isolation. We are known for social solidarity. We, the humankind, are known for social solidarity. So now we are, expected to do for last 4 or 5 months to do something that we are not used to. So under this scenario of what we are doing, we are not used to, it's very important to talk on our mental health issues, which is a key process to our overall well being. Under this context, it's time to welcome our second speaker, Dr. Ranjan Ghosh, a psychiatrist and a mental health activist. Dr. Ghosh, let me just give a short introduction about him before I hand it over to him. Dr. Ghosh is a pediatric psychiatrist from United States of America. He completed his academic career earlier from India and afterwards from USA. He practiced his work for 15 years in the States, after which he permanently shifted himself to India, currently in Kolkata, and he is currently practicing here. His area of focus is in the field of children, adolescents, adults in both preventive and curative mental health care, where he treats reducing suicide, post traumatic stress disorder, autism, and the like. He has also been a part of the mental health Bible that we call Diagnostic Statistical Manual DSM 4 as an editor. His area of interest is in giving therapies to patients with anxiety and panic disorders, obsessions, and depressions. He is also experienced and trained in psychoanalysis. He got his training from Dallas Psychoanalytic Institute. He is the founder of Good Karma, a pioneering organization in spreading mental health awareness in India. So let us all welcome Dr. Ranjan Ghosh, who will explore on how to manage the psychological impact of a pandemic and a lockdown that we are facing for the first time in our lives. Sir, it's over to you.
Thank you. You guys know the song? You too? It's an
Yes.
international conference, right? I hope you guys know you too. It's one of my favorite bands. It's gonna be a beautiful day. And the reason why I say this, I always like to start out with waking everybody up. Sanchita did such a good job. Mohita, thank you for that introduction. Dr. Banerjee, Dr. Guo, thank you. Basanti Devi College, you're an inspiration, teaching women how to be empowered, teaching them how to actually be financially independent. And that's actually freedom, is financial independence for women in this country. So I'm a big feminist. I feel like after coming back from the US in 2 years ago that I'm a bigger feminist than some women here. And that's no disrespect, but I really don't care what society thinks sometimes. I like to fight for causes. I like to fight for the underdog. And that's always gonna be me, I think. And that's one of the reasons I came back from the US. My mom passed away about, now it's I think 3 years ago. I gave her my word that I would come back and help India because, you know, I've always taken from India. I went to school in Darjeeling, St. Joseph's, North Point as a child. I went to Manipal and I left after doing my internship in Bangalore. And I had an illustrious career, like she mentioned, some DSM-5 and all that. But nothing brings me more joy and happiness than starting Good Karma here. After 1 year of being a HOD in Medica Hospital, I decided to make Good Karma because I could fight 3 things very, very easily, which was one was stigma, well, not easily, with everybody's help, I should say. Creating kind of a platform, an advocacy platform in regards to stigma, decreasing stigma, in regards to awareness and prevention, which means teaching children even from KG onwards, social emotional well-being and social emotional communication, because we are the most repressed society. And if, well, not the most, I don't know if we're the most, I think China's up there as well, but in South Asia, we have a lot of repression of feelings. And I think that stigma and that repression of feelings is leading to our highest sexual assault rates, our highest suicide rates in the world from age 15 to 29. And the last thing I'd like to say is also I believe in accessibility. And accessibility is in the form of being able and being available to everybody in India. From the gram, from the villages to the metropolitan area. And that's where Good Karma and My Good Karma app will come in hopefully soon. COVID pandemic has propelled this cause. I wish it was propelled by just change, but this epidemic of mental health cases has made it overwhelming for mental health professionals like myself and all around the town and all around India. Because what is happening now is that this pandemic is leading to so much crisis. Like, if you think about it, we have despair, increased health anxiety, financial insecurity. That's a big one. Feeling of hopelessness, social withdrawal, loneliness, a lot of what also Dr. Banerjee had already mentioned. But these things are happening every day in mass amounts. So even people that didn't have symptoms prior are having symptoms now. And it's just, it makes me sad, you know, because I have already lost 3 patients. I don't go to Medica anymore. And my friends and colleagues have lost more. Dr. Kunal Sharkar, my mentor, I mean, he's lost so many patients in COVID. Dr. Pradeep Shetty, I mean, we all talk, you know, we're all a community of physicians. And when the percentage of death is 13%, you best believe some of those physicians are calling me for my mental health support because they're not getting it from anywhere, as Dr. Banerjee had mentioned. They're not getting it. They're being ostracized at times. And is that really fair? So that's what we're talking about today is, I don't know about fairness because I just heard the lecture from Sanchita Devi, Dr. Ghosh, and you know, it's very unfair what happened to women in this country and other developing countries where there is no sort of freedom, if you will, for women at times, if you're not financially secure. So why are we talking about this? The CDC has even said all around the world, we've seen people have changes in eating patterns, worsening chronic health problems, worsening mental health, alcoholism, drugs, and using of medication, illegitimate medication, marijuana. All these things have increased during this pandemic. And fear and worry about health, like the chinta and the worrying that people are going through, is astronomically high. Because we don't know what will happen next. The fear of the unknown, I treat that a lot, fear of the unknown. Because we like to control things as human beings, especially for type A personalities, right? And we can't control it. There's nothing we can control about this situation. So how do we take care of ourselves? I like to really stress we need to take care of ourselves. If Teresa Victor, if you can mute that. We take breaks from watching, reading, or listening to news stories. We have to take breaks from social media. Like, even when I see social media things, I really cringe at times. Like, I don't want to see half the social media things. Also, how do we take care of our body? We take care of our bodies by, eating well, exercising, getting regular sleep. And I'll show you how to do that at the end of this session.
Mamta, please, Mamta Kumari, right.
Please bear with us. I think Dr. Ghosh has been disconnected. We are trying to have him back. I think there is a technological error.
Yeah, someone kicked me out on accident. Hello, can everybody hear me again?
Yes, sir, we can hear you now.
Yeah. So I got booted on accident. No problem. So we must make time to unwind, connect with others, and I'll show you guys how to do this. What do we need to do if we have kids and we're working from home? I think the main thing is to adapt to any new schedule. Like, in a matter of seconds, if you think about it, guys. I know you guys all study psychology, and my job, hopefully, with Good Karma or my Good Karma app, is one day be able to hire all of you guys. That's my mission, actually. But what in a couple of seconds, right? If you guys think about Kubler-Ross, in a couple of seconds or a couple of days, our whole life changed. So we think of stages of grief and loss, right? So most of us were in denial for a long time. Then there was some anger over South Asia. I'm pretty sure there still is. Then there's some bargaining. If I take this Ayurvedic medicine, or if I take this homeopathic medicine, or if I take this or I have hope on this immunization, maybe it'll go away. Then there's also depression, which is a big deal, right, to all of us. We all have to go through depression. I went through depression when my patient passed away in front of my eyes within 2 weeks. 70-year-old man that could have been avoided by us wearing masks. And then the last thing is acceptance. So we should all be pretty much in acceptance mode right now, but some of us may not be. This is the people that are not wearing masks. I'm talking directly to you. Don't be scared if you see me and then I run away from you or tell you something that you're not wearing a mask. This is a public health crisis. But the only thing to say this is that when we're in acceptance mode, then we start organizing. Like, for example, I got this light because I do online consultation. I got this microphone because this is all I do now. My driver's father-in-law tested positive for COVID. Now I'm here for 14 days in this room. So, it happens because this is going to happen in a pandemic, right? Have a routine, no matter what. If you have a solid routine, no one can mess with you. Easier said than done, but it should be done. You should drive yourself to have a routine. And if you think about it, there are 5 things we can do to prevent this thing. Besides, I'll go over the 5 things. The first thing is connecting with others. If we lose connection with others, the isolation increases. So what do I suggest? I suggest connecting with 3 people outside of the home in this format every day, no matter what. If you cannot do that for some odd reason, then you should talk to the people in your home in a deeper manner. Like, I'll give you just a simple, silly example. On Rabindranath Tagore's birthday, I asked my dad, why do you listen to this song? It sounds so melancholic to me. Why do you listen to this song? What does it remind you of in your childhood? Then he'd ask me, why do you listen to this Bangla rap? What does it remind you of? Why do you listen to this rock? And then we go back and forth and get to know each other better, right? So that is a deeper conversation that people normally don't have. They mostly like asking about, what will you eat for dinner? What is this next going on, right? So we want to connect with 3 people a day or in a deeper way. Number 2 is to be active. 30 to 45 minutes, I have to sweat it out and run. And we really, really, really need to be active with our children. We can do contests, silly contests like jumping jack contests, hula hoop, running around, because we are limited in time if we work from home, but do it all together as a family. Then everybody take showers, be fresh, go about your day. Be active, 30 to 45 minutes. Endorphins are released. Cortisol, our stress hormone, is decreased. Hence, prevention of mental health issues would happen. That happens when you sing loudly. That happens when you dance and do anything. And that's what Good Karma is preventing, expression and all these contests during this lockdown or unlocked period, whatever we want to call this now. We need to really promote that for every kid, every adult. Third thing is to keep learning. Did I know about Google Meet like this that can host like 200, 150 people? By the way, really great organized platform. Thank you guys for inviting me again. Very nice platform. So I didn't know about Google Meet. I didn't know about StreamYard. I didn't know about making an app, if you will. I didn't know about anything like that. I knew about psychiatry. I knew about analysis and psychology, but I did not know about all these things that I can reach, which is one of my missions, is to be accessible to everybody, right? So I didn't know about these things. So keeping my brain on and working is helping everybody. And I'm teaching my father to everybody to using technology, keeping themselves active, everything. Then also, if you look at giving, and I'm not saying like give somebody clothes or jewelry. Anjali Jewelers is right by my Gold Park office. I'm not saying go and buy some jewelry, although it would be nice, right? But I'm saying that you give compliments. You uplift people. Look, I'll tell you honestly, that's more about you and you feeling better when you say thank you to somebody. When you say dhanyavad, right? When you say thank you, it makes you feel better. When I give to my villages in Taki, my Dadu's land, I feel better as a person. I feel great. It's about me feeling better at that point. Same thing, serotonin, dopamine, noradrenaline, all these things help. And these are all scientific modulations, right? That I'm discussing. These 5 things we can do within 2-hour frame of our day. Every day, maybe 1.5 hours if you can do it very quickly and organized, right? The last thing is very, very important, and that is to be aware. What is it to be aware? Be aware isn't like be aware of what's your surrounding and wear a mask. No. Be aware is like if I see something and I look at it, right? Like this object right here. I'm paying attention to this. Well, now I'm talking, but I'm paying attention to this and thinking of nothing else. When anything is distracted from this, I'm trying to bring it back and doing that for a minute. At the same time, while I'm doing that, I can also, if I have a lot of chinta, a lot of anxiety, I can close my eyes and do deep breathing, which is very, very important. It stimulates your parasympathetic plexus, tells your sympathetic plexus to relax, right? And it's called the good karma pranayam. So a lot of people touch one nose and stuff. I'm like, no, that's not what we do. 3 seconds, breathe in through the nostril, as if you consider the door, it's a western door, it's opening, and then it's going this side. Okay, so while it's going this way, I'm taking it in with my chest expanded, my stomach pushed out, and then out through the mouth. So in, out, in, out. I'll just show you one or two, okay? It's like a balloon, and actually really reduces your volume of your body. It really works. So these 5 things, if you do this every day, guys, you can prevent mental health. And I've been giving a national platform because I've been teaching this 5 ways of wellness to adults and children, backing it by science, backing it with psychiatry, helping people get off medications, helping people stay on medications in some cases, but everybody's different. We need to understand that we need to listen to people if we're to battle the suicide rate together. We need to actively listen to people, not have judgment, understand people, and really, really, really promote their expression, not thing. Sometimes when I see this in our country, that when somebody's trying to express, you're like, shh, don't talk. Or it may be like, I'm depressed. And before the word depressed even comes out of the mouth, it's like, how can you be depressed? I've given you everything in this world. Like, why are you depressed? I'm a good parent. Why are you depressed? So that really shuts people down. Like I said, age 15 to 29, highest suicide in the world, guys. Not just in our region, it's the world. And in India, in West Bengal, we're 5% higher than the national average. So all I can say is that while you do these 5 things, I think it would be really, really good to think about other people. Think about the elderly, make sure that they have enough food, medications, and things. Think about the people that are coming out of quarantine. Just like mental health patients are stigmatized, like pagal, mental patient, pagal ke doctor, pagule doctor, mata chita, right? We heard it a lot. I've heard everything in this world, right? About psychiatry and mental well-being. But we're all patients, guys. Does that surprise you? We're all patients. A little bit mild, a little bit severe. Anybody can crack at any time. I just propose that to you before you judge somebody else. Support your loved ones. And like I said, do not stigmatize a mental health patient. Don't stigmatize a quarantine patient. When they come out of quarantine, it's unfair to do that. And let me tell you a little bit about acute stress, and I think maybe we can touch on questions then if you guys have questions for me. But so as a provider, if I'm sitting in the hospital and I'm seeing someone pass away like I did in this last 4 weeks or 3 weeks it was, you start taking that trauma on. You start becoming that person. If you're empathetic and you're good at your job, you jump into that person's shoes and you start taking that on. And sometimes you can take it on well, and sometimes you can be depressed. It's okay. It's okay to be depressed and seek treatment. It's okay to be depressed and talk to me. It's okay to be depressed and talk to other people. And it's really, really tough for everybody. I know that. I think it's tough for children mostly though too. So they're watching you guys. You're their number 1 role model. And the young adults in here, we're doing all kinds of things. Like I said, from Bangla rap to Rabindra Sangeet to everything to educate people. Actually, Good Karma's birthday is in 2 days on July 22nd. And we're releasing a track called Bipolar Neyami. And it's a beautiful song. These 20-something-year-olds just express themselves under my like production and direction, but they did such a good job that they're going to educate masses. So just think about what we can do, think out of the box, because we need to use technology right now in a safe medium. I know we all hate that and we're all praying for the immunization, but we need to be able to understand that we have to do this right now. There's no question. So all of these people that have died don't die in vain. And I really mean that, guys. I'm not just saying that. Look into yourself, look into the mirror. Yeah, we have to give up maybe classes, we have to give up this, we have to give up that, right? But we're actually preventing death. We're saving lives by staying at home as well. So with that, I will take your questions if you have any. And thank you for having me.
Sir, I have a question. Sir, can you hear me?
Yes, definitely. Tell me.
Children are confined within home. They are also stressed. How to manage their stress?
So one big thing I already mentioned was have a foolproof routine. Without a routine, I mean, you can try, but I don't think it would work well. Because what happens then at that point, right, without a routine, we make it to where the child has no conformity in their life. And already things are kind of chaotic and changing. So I make it a point to say, especially for special needs parents, I see a lot of them. My second passion is autism awareness. So I say we have to make a strict routine and follow it ourselves also. We can have 1 or 2 days of slack family time, but I think we need to follow the routine. As well as do the 5 ways of wellness with them. Like make sure they're active. They're missing their physical education class. They're binging on pizzas and all Western food has come here from US, all the things that I left behind, thinking that I left them behind. But then I see everything is here only. Taco Bell, Pizza Hut, Domino's, you know. So they got kicked out of US for a reason. People stopped eating it for a reason. Now they're preying on my people. I need to educate you guys. Carb loading and these things are not a good coping skill. Using drugs, using like food, excessive alcohol, anything like binging, like only binging on Netflix, those aren't good coping skills, no. We have to change them and transform them to good coping skills. Yes, thank you.
Sir, I have another question from Piali Haldar, faculty, Basanti Devi College.
Sure.
How an introvert person can overcome depression?
So an introvert, okay. I mean, so I think we have, can I just really quick share the screen and define depression first, just a second? It would just take just a second. I just want to just show you one graph. And then after I show this graph, I think it'll be clear. So I want to make sure that I'm answering the question correctly, that's why. When it comes to, can you see the screen, Dr. Banerjee? Can you guys see the screen?
No, sir, still not yet.
Okay. Okay, sorry, hold on 1 second. Here it
You
is.
can only see
I didn't share it. Just real quick, here it is. So do you guys see the screen right now?
Yeah,
This
it's
is
coming, sir.
Okay,
Yeah,
this is a typical mood disorder graph. Okay, guys? If I teach you nothing else, I taught you 2 things today. Cortisol is equal to stress, and bipolar and unipolar depression. So this is us. If this is entirely straight, we're dead or unconscious. Usually we have a little bit of sadness, a little bit of anger, anxiety, fight with our significant others, and then a little depression, and then we go back and up, right? Like this. Usually depression is like this, very flattening, meaning that sleep and appetite is affected. We have 2 major things that we lose our interest in things we like to do previously, and we have low moods, like sadness and crying. Also in this thing, we always blame ourselves. We have inappropriate guilt. We have suicidal thoughts. We think that, what's the point of living? Okay, this is when we're very slow our mind. Opposite though, is this hypomania, and I'll answer the question after telling this. Hypomania is something like where your mind is very active, it's going a mile a minute, it can't calm down, it's moving from one topic to the next, it's very loquacious like myself right now, rushing, and it makes you feel grandiose or like Superman, okay? Also, it makes you have no patience and very impulsive. So the combination of these two is deadly. So if you're telling me you have this versus this, they're two different things. An introvert, when they don't talk, has sometimes threshold or subsyndromal depression, but they don't never go to a major depressive disorder. Like me, when Sir passed away, I probably was up here, but I never went to major depressive disorder, if that makes any sense. So how can an introvert do it? Do it through the medium I love the most nowadays, talking, texting, or phone, right? So now we have a technology to use that introverts can use. Twitter was created by a mildly autistic gentleman, I don't know if you guys know this, because he didn't want to look at people's eyes and express himself, so he would tweet. So use technology, guys. I'm always here. I will give my number at the end. My team or I would always answer your questions. And it's my pleasure, actually. Is there another question, Dr.
Yes, sir. There is another question. Medical professionals help us, but it is easily understandable that they are also in stress. Is there anything we can do to help them?
Yeah, unfortunately, I took part in the nonviolence protests. I was shocked after I came back from the U.S. First, let's not aggressively treat them. Number one, let's stop that. Let's stop all of that. Like everywhere in the world, people are being hailed as medical professionals. Only in this country, people are being beaten. So let's stop that right now. Like let's report it. Let's prosecute. Let's do whatever it takes to stop violence. I can understand people are upset, but that doesn't mean you take it out on the medical professionals. I'll give you an example. If I'm upset at my rickshawala, right, for taking me, do I beat him? If he's drunk and he even curses me out, do I beat him? So if a doctor is narcissistic, even and treats you badly, do you beat him? Can I beat the president of US for being narcissistic? So first of all, let's stop. Let's be human beings. Stop beating people, number one. Number two is that let them live. They have the highest precautions in the hospital. They're safer than all of us, to be honest. They wear spacesuits for 4 to 5 hours a day, sweating, even in the highest ACs, because it's so hot in India. So my colleagues are literally losing weight, sweating in surgeries. Sometimes they're really sweating, they can't even see through the thing. They have to like quickly wipe off their thing, back to normal. So let's understand that they're more safe than us, okay? Number three, let's understand also that they have empathy, guys. Like they care about other people. They live this nightmare every day, things that we only see on the news. I mean, I lived just a small fraction and I was affected. Imagine their day in and day out. No. Obviously, they'll be affected. So think about the medical professionals. There are real heroes, they're real warriors, they're my friends. And I really beg you to understand. Is there another question or are we?
Thank you, sir. Here is a question from Sri Chinmoy De, Assistant Professor in English, Basanti Devi College. He has asked, how can one get rid of anxiety disorder? Would deep breathing exercises suffice? If we have to go through meditation, what are the ways? This is his question.
Very good question. So no, sometimes you can't deep breathe. So I do this deep breathing exercise now with teachers, principals, all kinds of staff, Tata, ITC, all the corporates. And then I see in the crowd when I'm doing the exercise, I make them do what I just did, right? I make them do the breathing, 3 seconds in, 3 seconds out. And I can see people get stuck. And when they're getting stuck, they're getting panicky. So no, deep breathing does not help if you have severe anxiety or panic attacks. What you need to do is then seek a professional. Panic attacks consist of palpitations, difficulty breathing, gas formation, headache, tingling and numbness, paresthesia, and sometimes even falling down and dizziness. So to prevent a panic attack, yes, you need medication management and cognitive behavioral therapy. That's the treatment of choice. Cognitive behavioral therapy is simply taking a negative automatic thought and making it a rational thought, as that negative thought has hijacked your brain. Okay, so how do we get the real thoughts, the realistic thoughts from into the actually fighting the automatic thought is the key. So that's what CBT is. That's what thing is, that in a panic attack situation or anxiety, we always think of the worst, called catastrophization. I think you guys might know the term. And we think of it as a catastrophe, right? And how do we prevent that? Only is through CBT, through medication management, through an SSRI. Please don't just take sleeping pills to treat it, because that's like taking Johnny Walker to treat it, honestly speaking. Don't do that. Do that. Get the counsel of a doctor that you trust, and a doctor that's knowledgeable about anxiety. That's my telltale. But yeah, SSRIs are very, very much used, and I will continue to use them. It's the safest medication.
Thank you, Dr. Ghosh.
Thank you.
I have one question.
Yes, please.
Teachers who are pretty senior and not habituated with modern techniques are sometimes unable to join online teaching, but students are very, very deprived. What should be the remedy under this situation?
Well, like I said, even Baba for my dad, right? He's 69 now, and so I teach him. I teach him. We can teach the teacher. We can teach the trainer, right? That's what I do. I train myself. I learn from you guys. Like anybody that's spoken today, like Sanchita, Dr. Ghosh, I learned from her. I learn from everybody. If we don't have openness to learning, like I said, the keep learning process, we're not going to survive, guys, as a race. We have to change. And I'll be honest with you. I hope nobody takes offense, but Bengalis are hard to change. I know that personally. So I just want people to change, because if we don't change, we can't adapt. And so I'm willing to teach anybody how to do Zoom classes. I think right now, because we don't have college, I think it's a travesty of justice, to be honest. I think we should start. I think the kid, whoever kids have it, if they don't have it, they should social distance, come into the classroom and learn from a screen. Protect the teacher, protect the senior teacher. That's what I think personally, but I'm not a policymaker. I'm nobody in this, but all I know is that we need to really learn, guys. It's not so hard. It might cost some money, yes, and that should be supplemented, I think, but it's not so hard to learn, honestly. It's pressing a link, to be real. If you have WhatsApp, which all of us do, it's pressing a link. Okay.
Thank you, sir, for your wonderful answer. We have many questions till now, but we have time. So
Hey, I'll give them my number. Please continue. I want to also see the poster presentation, but I have some patience, so I might come and join on later. But thank you very, very much. It was a very heartfelt thing, and all you guys, please don't ever be scared. Like, I know you have all your lecturers here, principal and all that. Ask your questions. This is what it's for, no? If you're feeling scared, then there's no point. That's why we drop our phone numbers. We have emergency hotlines. We do all these things, but if you guys don't access them, then what to do, right? Okay, thank you so much, Dr. Banerjee. It was a pleasure meeting you virtually. But thank you, Momita. I'll see you guys. Thank you, Parnadi. Take care. Bye.
Thank you, Dr. Ghosh, for
Yes.
your wonderful guidance regarding how to take care of our mental health. I think we have got a message from Dr. Ghosh that we have to accept taking care of mental health is very important. In a general situation, it's very important. So, in a pandemic, it's also very important. So, the message that he has given us to take care of our health, starting with the mental health, because the attitude towards our life is very important. To accept that there is a problem in our life, we have to seek a professional guidance. This is very important, to accept what we are going through right now. So, accepting the life we are going through, there can be problems, there can be challenges. So, it's very important to accept our mental health conditions to, manage the overall life currently during this pathetic crisis we are going on right now. Thank you, Dr. Ghosh, for your wonderful deliberation. Thank you, Dr. Banerjee, for guiding this question answer session so wonderfully. There is a really time constraint, so that
Monica,
yes,
one thing to say.
yes, ma'am.
Many questions are waiting for Dr. Ghosh. So we shall provide the phone number or mobile number of Dr. Ghosh in our
Yes.
chat box,
Yes.
chat box, and the questions may
Definitely.
be delivered by Dr. Ghosh.
Definitely. We are going to provide Dr. Ghosh, as has told all of you, that you can connect with him. So we are going to provide his phone number. You can contact him, and you can get your time-to-time mental health guidance from him. Thank you, Dr. Banerjee. So, as we have come to the end part of our day one webinar, it's incomplete as teachers for us without our students. So, we will be seeing a short presentation prepared by our students who are, currently for last 4 months who are under our guidance. We have a psychological counseling cell at our college. We have a psychological counselor, Srimati Swagata Datta, and all of our students from our college and also some students from outside our college from different institutions. Srimati Shagota Dotto is guiding them to have a balanced and a regulated mental health during this current pandemic situation. They have prepared a presentation keeping in mind about spreading mental health awareness regarding the situation. So we all are going to see the presentation shortly.
We would like to thank our esteemed institution, Basanti Devi College, our respected principal ma'am and teachers for giving us this opportunity and having faith in us for doing this presentation on COVID-19 and lockdown, a challenge to corona fighters and corona survivors from social standpoint.
COVID-19 and lockdown, a challenge to corona fighters and corona survivors from
I
the
would
social
like
standpoint.
to ask our
COVID-19
technical
disease
assistant,
oriented.
Shriman Shomik Chaudhary, to kindly intervene. The audio is not coming.
We would like to thank our esteemed institution, Basanti Devi College, our respected principal ma'am and teachers for giving us this opportunity and having faith in us for doing this presentation on COVID-19 and lockdown, a challenge to corona fighters and corona survivors from social standpoint.
COVID-19 and lockdown, a challenge to corona fighters and corona survivors from the social standpoint. COVID-19 disease oriented in December 2019, Wuhan, Hubei province, China. The COVID-19 pandemic is considered as the most crucial global health calamity of the century and the greatest challenge that the humankind faced. It has rapidly spread around the world, posing enormous health, economic, environmental, and social challenges to the entire human population. The coronavirus outbreak is severely disrupting the global economy. The COVID-19 pandemic is, by definition, a significant threat to humanity. The pandemic is threatening our healthcare and economic systems in ways that are significant and obvious. Beyond these domains, COVID-19 poses a profound threat to our most basic human motivations, especially human connection. COVID-19 impacts our mental health are likely variable across individuals.
No lockdown in lockdown. People who are frontline workers. Coronavirus outbreak has infected over 18 lakh people around the world, and doctors, healthcare professionals, medical staffs and researchers in the scientific community at the front line of the pandemic have gone above and beyond the line of duty to provide care for the patients. Essential goods and service providers like grocers, pharmacists, ambulance drivers, etc. worked diligently to mitigate the effects of lockdown. The journalists have worked day and night to deliver information to us. Air India pilots and crew members have brought stranded Indians to the country from different parts of the world through the Vande Bharat mission taken by the government. The people who have defeated coronavirus needs importance, and more importantly, we need to give importance to their role in the pandemic by donating their plasma to the ones who are affected by coronavirus. Last but not least, many frontline workers have lost their lives to save others. They may be gone, but their legacy remains. Living by the edges, identifying the sufferers and suggesting some relief strategies for them. Here, we need to give importance to the healthcare professionals, the police officers, the researchers and the NGOs who are working constantly to come up with new informations and are spreading awareness among the people. They are the ones who are giving their best to supply adequate test kits so that the people can get themselves tested. They are the ones who are risking their health and life to save others. They are also suggesting a self-quarantine period of 14 days to the ones who are not able to get easy access to the test kits. Now let's talk about some relief strategies. Maintain social distancing while you are out in public areas. Wash your hands with soap once you come back home from outside, or use sanitizers while you are outside in the public areas. Wear masks in public spaces. Take care of the senior citizens and pregnant women. Do not let them go outside if it is not needed. Save and respect the corona survivors. Do not go outside if it is not needed. Only go when it is needed. And most importantly, spread awareness and not false rumors.
Women are more vulnerable in this lockdown. The COVID-19 crisis has thrown these gender-based differences into even sharper relief. Regional frameworkers, multilateral organizations, and international financial institutions must recognize that women will play a critical role in resolving the crisis, and that measures to address the pandemic and its economic fallout should include a gender perspective. We see three areas where women and girls are particularly at risk and in need of stronger protections in the current crisis. First experience shows that domestic, sexual and gender-based violence increases during crises and disasters. Second, the majority of those on the front lines of the pandemic are women, because women make up 70% of health and social services staff globally. Finally, women are particularly vulnerable economically. Globally, women's personal finances are weaker than men's, and their position in the labor market is less secure. Moreover, women are more likely to be single parents who will be hit harder by the economic downturn that is now in full swing. Today, all countries are facing the same crisis, and none will prevail over COVID-19 by acting alone.
Corona Warriors, experiences to be shared by corona survivors. The novel coronavirus have caused approximately 23,187 deaths and 829,466 confirmed cases in India. The number of deaths around the world have crossed the 500,000 mark. But here, we will focus on the number of people who have successfully survived COVID-19. The social media sites and the news headlines are flooded with the experiences shared by the brave survivors of COVID-19. The experiences shared by them are very important as it is inspiring many sufferers to fight against coronavirus. Now let's talk about few experiences shared by the corona survivors. The healthcare professionals are doing their best in taking care of the person tested positive for COVID-19. They are strictly ordering them to be in self-quarantine as the intensity of the symptoms are different for different individual, and if any of the patient has serious conditions, they are admitted in the hospital. The doctors and the nurses and the other healthcare professionals are working day and night to serve the needed treatments to the patients. They are also trying to motivate their patients admitted in the hospitals. There is nothing to be scared about it. Just look into it as a common cold. And lastly but not least, accept the situation and be mentally strong. Don't lose hope from yourself. You can definitely defeat the virus. Have faith in yourself. If you become mentally weak, the virus will affect you badly. How to manage the psychological impact of a pandemic and lockdown. Firstly, we need to understand that it is very normal for an individual to feel depressed, anxious, stressed, and frustrated in this current situation as we are all going through a tough time. Don't think that you are alone in this situation. We are all in this together. We also need to understand that we are not accustomed to a static lifestyle like this. We are used to following our busy daily routine on a day-to-day basis, and a sudden change in the scenario have changed our daily routine as well, which is leading to insomnia, decrease in appetite, restlessness, and loss of interest in doing things that we used to enjoy doing earlier. Many people are facing pressure due to loss of jobs and economic crisis because at this time, countless number of people have lost their jobs or sources of income, which is also causing them to feel the above mentioned situations. Small gestures counts a lot. Just showing a bit of love, care and respect towards the people around us can change many things. Spending time with our family can keep us happier and away from the outside world. Planning activities like exercise, games, meditation and many more with friends and family will keep us connected to our loved ones. We need to be positive. With a little effort, we can all pass through this situation. Though this situation has impacted us badly, but try to look on the positive side as well. For this situation, we are able to spend some quality time with our grandparents, parents, and siblings. Just remember, every cloud has a silver lining. Thank you.
Thank you, our beloved students, for your wonderful effort to disseminate the mental health awareness. Thank you, our audience. I can see that around 145 people are there, which is a great encouragement for our students who have worked really hard to prepare this presentation and who are currently working really hard to spread the mental health awareness. I'm really sure, I believe that all of you students who are actively there with the counseling cell right now in our college, you can become a mental health professional in future very soon, which is a need of the hour, as we all are mentally devastated, we are mentally shattered because we don't know what is going to happen tomorrow. As every day the cases are increasing, every now and then our neighbor are getting infected with COVID-19 virus. So mental health is now really a need of the hour. So finally, thank you to all of you. Thank you all the participants who have participated today. Thank you, Dr. Shonchita Ghosh and Dr. Ranjan Ghosh for joining this session and for your wonderful guidance, which is, I think beyond thanking. Thank you, our coordinators. Thank you, our Honorable Principal Ma'am, for giving us this opportunity for conducting this international level discussion. I think the day one has given us some message about how to keep a little bit of positivity in our life in such a negative situation. I hope to have you all in tomorrow, same place, same time, to have another area of discussion, which can which I am very sure, which is going to enlighten us again which can really help us to have a better life, a better future. Thank you. We are ending here.